Hi, my name is Lynn. I'm a level 1 nursing student. I'm following you today. Would you mind giving me an S-bar on your patient?
Sure. The patient we have here, her name is Shanana O'Connor. She's a 30-year-old female. She is in room 231. She came in with a fever with undetermined origin. The secondary diagnosis is end-stage renal disease, secondary to diabetic neuropathy, which was diagnosed 1 year ago. And her provider is E. Engelberg. She is 5'9", 177 pounds. She's on a renal diet, and she does have an allergy to trimethoprim sulfamethoxazole, which causes a rash. She came in with fever and chills and a general malaise with elevated blood glucose levels and decreased appetite in the past few days. She has also had minimal urine output the last month, has been going through hemodialysis the past 3 weeks, 3 times a week, per year, from this past year. She did list for a transplant 6 months ago. She does have a history of UTIs. She was diagnosed with her diabetic type 1 8 years ago. And let's see here. So she has reported sensation diminished in the lower limbs. I did notice a brewery and thrill present in the intermittent system. Her respiratory is fine. Her cardiovascular, her cap refill is less than 4 seconds. Tachycardic rhythm, slight 1+ pitting edema in lower extremities. The pedal pulses are 1+ in both feet. Her GI is fine. Her GU, the patient reports urine is concentrated, darker, but denies pain, burning, or difficulty. She does have a left forearm EV graft surgically created 11 months ago with no complications, and a tonsillectomy about 10 years ago. She reports weight gain of 10 pounds over the past few weeks. She does have a peripheral 18-gauge IV in right arm. Her last vitals were taken at 7:30 with a temperature of 101.1, a heart rate of 95, O2 stats were 96. Her blood pressure was 138/78, and her respiratory rate was 20. And I'm going to recommend to the doctor that we get some glucose in her EMR because she doesn't have, get some insulin in her EMR because her glucose has been high. Last one was 155, and she doesn't have any insulin on her EMR, so I'm going to call the doctor and see if he wants insulin ordered. And right now, what we're going to do is we're going to go give medication, the enipentin cilastatin. It's an IV injection, and I think that's it. Do you have any other questions for me?
Yes, I actually do. Why specifically is this client receiving this medication?
The patient has an elevated temperature of 101.1 degrees Fahrenheit with an elevated white blood cell count. This shows signs of infection, and so this is an antibiotic we're going to give to her to help get rid of that infection.
Okay. What action does the medication have on the body?
Medication is going to bind to the bacterial cell walls and cause cell death.
When should you question administering this medication?
I question administering the medication if it appeared to be damaging her renal system even further, since it is used cautiously in renal impairment, and also if she had any other medications on her EMR that would cause a drug-on-drug interaction.
Okay. Does this medication have a therapeutic serum level?
Yes, it is 150 to 300 ng/ml.
And which vital signs must be monitored?
I'm going to monitor her blood pressure and her temperature, make sure her temperature is going down, and her blood pressure, make sure she's not having any hypertensive or hypotensive reactions.
Okay. Which physiological parameters should be monitored when the medication is being administered?
I'm going to monitor her consciousness. I'm going to monitor for any headache or dizziness because it can cause seizures. So we want to make sure none of that's happening. I'm also going to check her white blood cell count repeatedly to make sure that her white blood cell count is going lower to see that the medication is working against that infection.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
So we're going to make sure the patient understands that she does have the right to refuse this medication. We're going to make sure there's no other drugs in her MAR that would cause a drug-on-drug interaction, and we're also going to make sure she doesn't have any allergies to this medication in particular.
What interventions must be taught for taking the medication safely at home?
We don't usually do this medication in particular with this route at home, but we do want to make sure that she does recognize the signs and symptoms of a superinfection, which could be a black furry overgrowth on the tongue, and any other of those signs that I was talking about, the consciousness, headaches. And if she does have any of that, she does need to notify her provider.
Okay, and what are the side effects and potential adverse reactions?
As I said before, there's seizures is a big one. This medication can cause C. diff, so we want to make sure she understands what that is, and it can also cause rash, diarrhea, nausea, dizziness.
Okay, and how will you know the medication is effective?
Whenever the signs and symptoms of the infection are gone.
Okay, I don't have any more questions.
Okay, you ready to go in?
Yes.
Okay. Hello. How are you doing today?
Okay, thank you.
Good. My name is Lydia. I'm going to be your nurse for today. And here I have with me Lynn. She's a student nurse. She's level 1. Today we're going to be giving your antibiotic, and it's going to be through the IV route. So we're going to put it in your IV right there. The medication is called anipipin cilastatin. Do you know anything about it? No? Okay,
No.
so it's an antibiotic. It's gonna help treat the infection we think you have, and it's gonna do that by connecting with the cell walls, causing cell death to the bacteria. And it does have a few side effects I just want to let you know about. There could be nausea, dizziness, there might be diarrhea, because it can cause a thing called C. diff, which is another type of infection. It can cause rash, and it might cause seizures. Alright?
Okay.
I just want to put on the gloves.
And I did write on that other sheet about like when it kicks in.
Alright, and can you tell me your name and date of birth?
Shamina Corner. April 1st, 82.
Okay. And I did see in your chart you do have an allergy to, sorry, I have to look at it, it's hard to pronounce. The trimiprin sulfazazole, is that
Yeah.
right? Yep. Do you
That's
have any
correct.
other allergies that we need to know about?
No.
No? Okay. Alrighty. So, let me go ahead and scan you first. Can you tell me your name and date of birth again?
Shanada Corner. April 1st, 82.
And first, I'm going to hang the normal saline. This is the primary line. It's going to be hanged with your secondary, which is your antibiotic. So I just want to make sure that the primary is correct. It's the right time, dose, route, patient. It's going to be, the rate's going to be 30 milliliters per hour. And it's going to be continuous. And it is the right time. And I want to make sure I check for its clarity, make sure it's not leaking. Also want to check the expiration date. We don't want to give the patient expired medication. Alrighty. And then here one more time. Scan that. Okay. It's green, so it's good. Are you feeling any pain right now, Mr. Corner?
No,
No.
no pain.
Good. Because if you do experience any pain, I can, I didn't see anything in your, oh, I do see something in your mark. So if you do need anything, just let me know.
Okay, thank you.
Mm-hmm. Make sure this is clamped. Fill it up halfway.
So
And then
we always check
I'm gonna
our,
prime my line.
we call it the MAR, medication administration record. Pulling it up. Oh, can you tell me about your pain? I know it was just, they just rated it as a 4, and you got some medicine about 15 minutes ago. Can you tell me about that?
Yeah, it's still a 4.
Okay. Well, the medicine that you just got was a acetaminophen that kicks in 30 minutes to an hour. So basically the next 15 or 30, up to 45 minutes, you should be taking in 40. Okay. All right, so that should be smooth.
Make sure we get out any bubbles.
Can you put the pain like where it is? I know you have general achiness, but what about this other pain?
Yeah, general achiness and then pain.
No bubbles, no troubles.
Okay.
It's kind of a, kind of there, you know. Yeah, it's like a sharp. Not too much constant, but yeah, it's kind of sharp. When it's hitting, it's like a 4.
First bag we're going to do is going to be the actual 1,000 milliliters. It looks like 500, it's really 1,000 milliliters.
Okay.
That's 0.9 ounce. That's going to go first.
Right.
Mm-hmm.
This is the primary line, piggyback secondary line. Okay? So I'm just going to set myself up where I can go.
Just document this real quick.
This is, I'm going to confirm this. Okay, ticket. It's, 30 milliliters per hour is continuous.
Okay.
I checked it once here.
Yep.
Check the other one just while here too. Imipenem, Solostat injections. Primaxin, it's an IV. It's 500 milliliters. It's gonna go in about an hour.
Okay.
What I'd like to do next is, I want to, we're gonna do the saline first.
Okay.
And I'm gonna scan your finger.
Yeah.
Scan this. Sometimes they have to walk over and find the little- Can you stay with me for just a second?
Sure.
Okay.
I can't read them because it's kind of, oh.
So now I'm gonna set up
Stay with me. Okay, guys.
your antibiotic. Alrighty. And before I administer this, do you remember 2 of those signs and symptoms I told you about?
So I know it's could cause dizziness and rash.
Okay. All right. Good. And just want to make sure you're aware that you do have the right to refuse this medication.
Okay.
All right. Do you want to take it? Yep. All right. Good. All right. So let me scan you first. Can you tell me your name and date of birth one more time?
Shanana Connor, April 1st, 82.
Okay. You got the right patient. and make sure we got the right drug. I'm gonna make sure that this one is clear and not leaking any damage. Make sure this one's not expired. And it is the right medication, the indapamide cilastatin. All right. We're gonna give an IV piggyback. It's gonna be 500 milligrams. And we're gonna do it her IV.
Finish documenting after this all.
Okay. Alright, looks good. I'll compare it one more time. Alright, 500 milligrams per 100 milliliters, and then we're going to administer over 1 hour. Alright, so let me get this set up. We're going to hand our primary lower than our secondary. Make sure this is clean.
Just had to go back out and go back in.
Fill it up halfway. Let me make sure I prime it first. We want to make sure we're not wasting any meds, so I'm just going to do it slowly.
Want to get your armband ready for me again?
Yeah, that's right.
Alright. And I've already checked to make sure that these, the saline and the medication are Y compatible. And you can look up that sources and that information on many sources.
Hi, Rosemary. I'm Katie. I'm a nursing student next door.
Alright, and then
Okay. Can you give me your
alright,
on your
it's
computer?
time. Well, let me document first before I can.
This one is going to scan your band again, you scan the medicine, and it'll start the second one. You won't think about closing it. Okay, so this is sterile, that cap is sterile, so you don't want to touch that with your finger. So, touch it. Line clamp closed. Go ahead and hang it up.
Everything's clamped off. Alright, now it should be good to connect it to your site.
This is the part like, I want to get the right there, if we do this at home.
You want to check your site, make sure it's usable. It looks good. Alrighty. And I'm gonna flush it first. Get out the air bubble.
Here's two things.
seems to be working. Yeah, one more time. I'll clean that again since it touched. I'm gonna set the pump now.
I'm sorry, I have a couple questions. Why is the client receiving this medication?
It's an anti-infective, and so she currently has an infection treatment.
And what action does this medication have in the body? And what medication is it?
Well, the medication binds to the bacterial cell wall, which is the result of that bacteria. And, she actually is being administered, Imectin, and that is actually now, which will be administering shortly.
When did you question administering the
This particular
Select channel
medicine
A.
is,
I'm gonna put in the primary first, which is 0.9 normal saline.
so we do want to keep an eye on the
Is this correct? Yes.
renal disease and,
And our rate is going to be 30 milliliters per hour, and the rate to be infused is 1,000 milliliters. Alright, that looks good, so I'm going to check my secondary now. Put in my secondary, sorry.
One direction, go all the way through the other.
Got the ibuprofen, psilocybin, and it is 500 milligrams per 100 milliliters. Yes. Alrighty. Now we calculated the rate to be infused, and it's going to be 100 milliliters per, and it's going to be infused over an hour. So we're going to go next.
What intervention
So duration's going to be 1 hour. Alright, everything looks good. So let's go ahead and start. Make sure I clamp everything.
Okay.
What are other side effects and adverse
So, this one cannot,
Everything goes well.
And the medicine.
Should watch this to drop 5 times. So 1, 2.
And how will you know if that patient
Click on the next medicine.
she should
That's
start.
counted. I've already checked everything. I'm on my second time checking the med.
Okay, great.
Scan your band.
4, 5. Okay, seems to be working well.
Hi, Miss
Great.
O'Connor. How are you? I'm Rosemary. I'm going to be your nurse.
So I'm done with everything I need to do right now. For you, is there anything I need to do for you?
No, I'm okay.
You're
Thank you.
okay? Yeah? Alright, I'll just go ahead and put your bed down.
So now you're getting the imipenem. Are you? I do see that you have an allergic reaction to.
And I do have a call light for you. There you go. There's your call light. And before I forget, I did
So because
print up some
we have
information
a
about
history
the medication you're getting, in case you want to know a little bit more about it.
We
All
want to
right.
make sure that
Thank
we
you.
monitor that.
thing.
So I'm going to go ahead. This medication, if you do see any rash,
I'll check up on you in about
experiencing any
20,
lesions,
30
any
minutes to see how you're doing, okay?
Okay.
Okay.
Door closed?
Yes, please.
Okay. Alrighty. Did you have any other questions for me?
Yes, were there any pertinent pieces of information you reviewed before administering the client the medication?
Yeah, I checked to make sure that the medication was Y compatible with the saline, and I did check to make sure she didn't have any other allergies besides the one we have in our chart here, and then I also checked to make sure that the rate and dosage was right on the pump and the medication.
Did this information affect your decision to administer the medication?
Yeah. So if it wasn't compatible, I would have held the medication. I would have called the provider, see what else we can do for her, maybe get a different medication or do it through a different route. Also, if she had any allergies, would have held the or if she exhibited any signs of allergies to the medication, then I'll go ahead and hold that. Also, if it was the wrong dose or rate, I would go ahead and call the provider, make sure that everything he put into the MAR was correct.
Okay, did this information affect how you administer the medication?
Yes, if the antibiotic was not compatible, I would have went ahead and held that medication and see if I could call the provider and see if that we can get it through a different route or a different medication that was compatible with the saline.
Okay, that's all I have. Thank you.
Okay, thank you. Do you want to watch me chart?
Sure.
Okay.